Welcome back. You can call this number 0808-054-2233 for any questions you have on this topic. The number again is 0808-054-2233. So far we've spoken about cerebral palsy. We're talking now about cleft lip and palate. But you can always call in about conditions like Down syndrome or even polio. But thankfully, polio is being eradicated.
On its way out.
You can also tweet at CTV_Mary A while we continue. Now that question, this is what I'm saying. A child is born, he has cleft lip, cleft palate. Maybe this is an enlightened parent that goes straight to the hospital and therapy is started. Can this child be okay to, be completely reconstructed by the time the milestone of speech gets there? That means that for the normal child and him, they will start speaking at the same time. So he doesn't have a hiccup in development. That's what I'm asking.
The answer is yes. Once the child comes early enough, the child is evaluated. The child can have cleft lip isolated, cleft palate isolated, or combined. They don't always occur together. So a child who has cleft palate, even if the child has it too, the surgeries are done at different times. But the surgeries or interventions are planned such that it will have been concluded by the time the child is making attempts at phonetics speech.
Okay.
You understand? But even at that, even after closing the hole, that's not the end of the story, like I said. After closing the hole, the communication between the mouth and the nose, the child will still have to be referred to speech pathology, so she will have series of speech therapy. So
there's still a challenge in spite of the fact that he's starting to talk the same time as the other child.
Definitely. The challenge will still be there. So it will take a while. And I'll tell you, almost invariably, there may be some little speech deficiency.
At the end of the day?
But it will be passable. It will be passable. I know there are some, I won't mention names, but there are some notable politicians who are known to have had cleft palate. They had speech problems, but they've went ahead and they did well in life. They were able to talk and people communicated appropriately and people heard them. So, yes, if it's done properly and done in good time, the speech will be within normal range of acceptance.
Okay, we have a phone call coming in. Who is on the line? Let's see. Mike is calling. Hello, Mike.
Hello.
What's your question, Mike? Welcome to the show.
Hello.
Hello, we can hear you. Go on with your question.
Please, I have a child in a condition of CP.
Okay.
He's 13 years now, and he can speak very well, but he's finding it very difficult to make use of his leg and arms.
Okay. We're talking about cerebral palsy, right?
Yes. CP.
Yeah, he said CP.
No,
you know, cerebral palsy, it could be cleft palate. Okay, thank you, Mike. So, speak to us.
So, what is the question? He says the child is having problems with movements. Oh, yes, that is. Cerebral palsy is, unfortunately, cannot be cured. Unfortunately, the damage to the central nervous system is permanent.
Okay.
Unlike peripheral nervous system, where you can repair nerves that are destroyed in the peripheral nerves. But in the brain and spinal cord, any damage there is permanent.
Okay, so this is something from the brain.
It's from the brain. Cerebral palsy, like I said earlier, it is an assault on the developing brain. And I mentioned two conditions, beta asphyxia. Maybe children who have difficulty with childbirth, difficult labor.
That's where antenatals come in.
Care has to be very good to prevent it. Then children who have jaundice, neonatal jaundice. Yellowing of the eyes.
That's postnatal care.
Oh, yeah,
so some of these things can actually be taken care of if there's enough attention during pregnancy and at birth.
Exactly. So if you know the conditions that can cause it and try to avoid them around the perinatal period, most of the children will not have it. Although, like I said, some are also without any known cause. But these are the causes that are known and they are prevented. Okay? So as the young man had mentioned, the challenges with movement are there. So what we do is to manage the condition.
Okay.
Try to do whatever we can do to make it easier for them. And that's why we have physiotherapy, we have occupational therapists, and we have orthotists to provide splints for them. And sometimes when it gets too difficult for these people, surgery comes in to release some of those.
Or sometimes the use of a wheelchair, right?
No, wheelchair is more for patients with polioparesis.
Okay.
Okay, but if their condition is so bad that orthotic devices will not assist them in mobilization, then they will have to use wheelchair.
But he says that his child can speak very well.
Yes.
How often does that happen?
Oh, yes. The children with cerebral palsy, interestingly, most of them don't have problem with mental retardation.
Okay,
They
that's
can,
comforting.
oh, they don't. Unlike children with Down syndrome. In Down syndrome, the major concern there is mental health.